Hi, I'm Bob Herbert. Welcome to OpEd.tv. My guest this week is a very special friend who knows as much about caring for the health needs of children as anyone in this country. Dr. Irwin Redlener is a pediatrician, co-founder with the singer Paul Simon of the Children's Health Fund, a world-class teacher and mentor, and, as if he didn't have enough to do, a special advisor to New York Mayor Bill de Blasio on disaster preparedness. I'm exhausted just reading that. Irwin, welcome.
Exhausted hearing it. Yeah.
It's great to see you. Thanks for coming in. I appreciate it.
Thank you, Bob.
So we're going to talk about sort of the health challenges facing children in the United States in general. But first, I'd like to talk a little bit about the situation on our southwestern border. So we've had, over the past year and a half, tens of thousands of unaccompanied minors come into the United States. Some are fleeing violence, some are fleeing dire poverty, looking for a better life. In a general sense, as Americans, how should we approach this problem? Do we make a distinction between the reasons they came here? How do we look at it?
Well, this is a complicated challenge for us, and I think that it's unfortunately getting mixed up in the whole question of the politics of immigration reform and all of that stuff. But at the end of the day, we have children who are in distress, who are needy, and many of whom are fleeing actually quite severe conditions in their home countries, particularly places like Honduras, where gang violence is rampant and children are seriously under threat. And then the question comes: are these children really asylum seekers, not just people coming across the border? And when they come across the border, it's not just a simple few hours of getting online and crossing the border. We're talking about a life-endangering trek coming from Central America through Mexico and then into the United States. A really great risk. And even if they weren't unaccompanied, like so many of them are, they're facing tremendous risks just traversing from their home country to the U.S.
When they finally get here, and their situation has to be sorted out, some have relatives in the United States. The government in some cases tries to hook them up with those relatives. Some, as you point out, might have a case for asylum, in which case a whole legal process has to be explored. Do you know what the conditions are in which they're kept as all of these sorts of things are sorted out? Are they in clean, healthy, safe environments?
Well, first of all, it's interesting because the federal government is responsible for the care and support of the truly unaccompanied children that are coming here. And I'm saying that because some of them are actually with families. The families may be behind them, waiting for them or whatever. And the ones with families are actually going to centers for evaluation and initial management that are controlled by the state. For example, the state of Texas, and the health department there is monitoring, caring for those children and families. The ones that are truly unaccompanied are going to federal facilities, for which there's not been a whole lot of visibility or transparency. However, I do have people that I know quite well that are working in the federal system, and they're telling me that the kids are really in pretty good shape medically. So they're not coming across with rampant, tropical diseases or anything exotic. They may be exhausted. They're actually unexpectedly well immunized. In some cases, better immunized coming from Central America than kids in South Central LA, for example, or in the South Bronx. Yeah, which is quite interesting. But the fact of the matter is that they're also traumatized emotionally. For young children to go on a trek like this is without their parents, as you can imagine, is distinctly traumatizing. And so there's a lot of mental health support that's needed, and especially a lot of legal support that's needed. In a way, their legal and mental health challenges overwhelm the medical issues by far. So these kids are apparently well cared for in the federal facilities. I think they are. And then they get sent to various places, including New York City, where they're screened again, and lawyers and others are trying to make sure they get situated with family members as soon as possible.
You talked about the trauma that a lot of these youngsters have faced. The ones who are fleeing the violence, especially in a place like Honduras, some of them have seen friends murdered or relatives murdered. Some have been abused themselves by drug gangs and that sort of thing. Some of the girls have been raped. There have been attempts to force some of the girls into prostitution and that sort of thing. What are, in a general sense, some of the psychological consequences of facing these kinds of issues at such an early age?
Well, of course, it depends on the age of the child, and it depends on what they've experienced, and it also depends on their makeup. Some children being much more resilient than others, just as a matter of statistically, some kids are, no matter where they're living, are very resilient, and others are not so resilient. But the circumstances that these children endure challenges anybody's level of resilience, and especially those, as you're pointing out, Bob, that have either been the victim of or who have witnessed rape, murder, violence, all sorts of really things that kids should never be exposed to. And some of them are fine once they get situated, but some of them are going to carry long-term consequences from a psychological point of view that will, sort of never leave them in a way. They'll get supported, they'll get treated, but it's going to be a long road for some of these children.
Now, I mentioned that you're an expert on disaster preparedness, and this is a humanitarian crisis, and we seem totally unprepared for this huge surge of unaccompanied minors. Now, children have been coming to the United States actually for years, not accompanied by adults coming across that southwestern border. But we've had this tremendous surge over the past year, year and a half, and that sort of thing, and we weren't ready for it. Why is it that you think that so often these disasters occur and we just have not made preparations? We don't have contingency plans.
Well, there's something about getting ready for disasters sort of akin to buying insurance on yourself, for health insurance or life insurance or whatever you think. And when times are bad economically, one of the first things to go is, what you're going to do to prepare for the future, because it isn't the future yet. It's never quite the future
Right.
yet. And so people will defer those expenses. But there's something very different about this issue here, because these are issues that, disasters, recurring disasters, are something we've been facing with great frequency, really, especially since 9/11. Natural and not natural disasters affecting large numbers of people. But we're really not yet at a place where we could say we're intelligently planning. We don't have to bet the whole house on this, but you do have to put something aside and have a focus on getting ready. And if you don't, you pay a big price. The other thing I should say about the number of children coming across, and it's like New York City, for instance, is concerned about the children that are coming here, but let's say 6,000, 7,000, 8,000 kids will end up in New York City, even though they've come in through the Southwest. It's really a drop in the bucket. New York City's infrastructure can accept those kids. If you speak to people in City Hall, they're concerned about the 22,000 children already living in the shelters and many, many other healthcare needs for children. So a few more actually could be accommodated. In the greater scheme of things, they will be. Part of the attention given to this issue really is driven by the politics. It's just been an area where people on both sides of immigration issues can come in and make their points. For many people, myself included, this is a out-and-out humanitarian agenda where we have to take care of vulnerable children who have come across the borders, however they've gotten here, whatever the circumstances are. And for other people, it represents a failure of immigration policies, and we should rectify that by, sending the children back or whatever the case may be. So it's become a political football in addition to a humanitarian crisis that makes it very confusing. It also makes it very difficult, I must say, for journalists to cover this story because it's so multi-layered and confusing. At the end of the day, we have kids who need help, and we're not asking why they need help right now. We're asking what help do they need, and I think that's really important for us to focus on.
Now, you mentioned the homeless children in New York, which leads me to the next area I want to talk to you about. I met you in the late 1980s when I was a columnist at the Daily News, long ago. And you had only recently created the Children's Health Fund with Paul Simon. How did that come about, and how did you ever get hooked up with Paul Simon, of all people?
Yeah, so I was on the board of directors of USA for Africa, which is the outfit that produced the record "We Are the World," written by Michael Jackson and Lionel Richie, right? So, And they needed a doctor to help them figure out what to do in Ethiopia and sub-Saharan Africa, because that's what this whole enterprise was about. It was about raising money to help the famine in sub-Saharan Africa. Paul Simon was one of the singers on We Are the World Record. It sold a lot of copies, $57 million.
I would say.
$57 million raised in 1985, I guess it was.
Wow.
It was a tremendous amount of money then. I guess it is now too.
I'd take
But
it.
relatively speaking, yes, you would. I would too. So what Paul wanted was, he said, we raised this money to help sub-Saharan Africa. Can we leave a little bit of it, a small percentage, 5%, in the U.S. to deal with homelessness and other problems, including hunger, in American children, especially living in low-income, disadvantaged communities in our cities. He was living in New York City at the time. And USA for Africa said, not really, but you should meet Irwin Redlener. He'll talk to you about what needs to be done in New York, because that's where I was based. So I took Paul on a tour of some of the most incredible sites in New York City having to do with the homeless shelters.
Those were the days that we had welfare hotels.
We had welfare hotels
in New York City,
right,
and a burgeoning homeless population.
Absolutely, and these hotels were absolute urban squalor, packed with people and in distress, hungry children. It was, and I walked into the Martinique Hotel, which is now kind of a fancy hotel, where I had lunch today on 32nd Street and Broadway.
Which, if anyone saw it back in those days, this is absolutely hard to believe.
The last place you'd ever check in your life would be. But it's, you know, it's been updated, and it's now a very active, busy hotel. But the point is, we walked in there in 1986, this was, and we're stunned. I mean, Paul was speechless at what we were observing in there. And he said, what needs to be done here? And I said, I'm a pediatrician. These children aren't getting medical care. Why don't we set up a program? We'll bring doctors and nurses here to take care of the kids. They need a lot of other things, but I know about pediatrics. Paul thought that was a dandy idea. Karen Redlener, my wife, who'd been working with me since we met, actually was given Paul Simon's office. He went on the Graceland tour. She operated out of his office here on Broadway and developed a mobile medical clinic.
Karen developed the mobile medical clinic.
Karen designed the mobile medical clinic.
Right.
And that became the kind of the symbol, the hallmark of what we were trying to do. And we were bringing doctors and nurses to these shelters then after that to care for these children.
So you had one of these mobile vans,
right,
fully equipped medical unit.
Yeah.
What did you do with it?
Well, they were fully equipped clinics on wheels, in essence.
Mm-hmm.
So as opposed to just carrying a little doctor's bag on house calls, we took the whole office, in essence.
Right.
And that's really what it was. And we would stop on a regular basis at different welfare hotels, including the Martinique, where Paul and I had first gone. And we developed relationships with the social service staff that was helping those families. And we would come back on a regular basis, and we would be their doctor, in essence.
You deliver primary care to these
primary health
shelters.
care. And it was working wonderfully. And then Paul said, why don't we raise some money and do another one? And he held a big concert in Madison Square Garden. We raised more money. And then suddenly we had 3 mobile units.
When you mentioned the concert at Madison Square Garden, do you remember who was at that concert?
I do. It was extraordinary. It was obviously Paul Simon was the headliner.
Mm-hmm.
Billy Joel, James Taylor, Dion. I mean, it was just
Bruce Springsteen was there.
Oh, it was incredible.
It was an amazing concert. Raised a lot of money.
So with that money, we went and got a second and then a third unit, mobile unit, and then we had 3, and then we had a staff of 40, and then other people around the country were interested in what we were doing, and you know, fast forward to today, we have 50. Mobile units in 24 locations around the country.
Still serving low-income children?
Yeah, not just homeless anymore, but
right,
migrant kids who are just living in profound rural poverty, all sorts of conditions that make children vulnerable. And that's what our hallmark has been, caring for the most medically underserved, disadvantaged children, rural and urban, in the country. And that's what we do.
Now, you mentioned the number of homeless children and families in New York City now in 2014. Talk about that population a little bit and tell us why it's so large after all these years.
When we first started the program, one of the things I was very interested in is not just providing services, but also doing advocacy on behalf of getting at some of the root problems. In the case of homelessness, we were doing okay until the big recession hit. And on an average night in 1987, there was about 12,000 children in welfare hotels and shelters. In 2014, it's about almost 22,000 on an average night. So we have almost a doubling of the homeless child population. Now, the conditions are better than they were. We don't have these big, squalor-infested facilities that we had then, but we have huge numbers of children still problematic. Part of it's the recession. Part of it's is the elimination of support for public housing that used to come from the federal government. And part of it is it's just not getting the attention that it used to have. And, we're leaving a lot of children totally marginalized along with their families. And this is an ongoing problem that we don't really have a handle on how to solve yet.
Now, we have made some significant advances in the care of low-income children since the 1980s. There was the CHIP program, Children's Health Insurance Program.
Yep.
We now have Obamacare. Is it too early to tell the impact of Obamacare on children's health services yet?
Yeah, that's a good question. And the general trend is it's actually very good for low-income children and children who are in the margins between being a Medicaid population and, on the other side, not being able to afford the private insurance rates. And several million children who were previously without health insurance are going to be with health insurance because of the Affordable Care Act, or Obamacare. So we're fans of it, but even if it's fully implemented, there's going to be 2 or 3 million children still not getting the care that they need. For one thing, for example, the provisions in the Affordable Care Act preclude immigrant children from getting any of the services under the Affordable Care Act. We think that needs to be fixed, that particular flaw. It's not, the plan that I would have designed, but on the other hand, it has to be called progress. But the key issue that I think is important to note is that the Affordable Care Act gives health insurance. It doesn't necessarily give health care.
Right.
So if you have health insurance, but you live in a county with no doctors there, it's not going to do you much good. So we're interested in the access to care part in addition to the insurance for care part.
One of the problems with the Affordable Care Act is that in some states, Republican states headed by Republican governors, there's been an unwillingness in some cases to expand Medicaid, which is what was supposed to happen under Obamacare.
Correct.
Talk about the implications for children when that occurs.
Well, it's a disaster because the children who are right now in the margins in between Medicaid and being able to afford regular private health insurance were, in a sense, waiting for this expansion of Medicaid to make sure that they got the care that they need and had insurance coverage for it. I see the refusal to expand Medicaid as a blatantly political act by those who are sort of ideologically opposed to any kind of health reform plan, and particularly ones that come from a Democratic president like Barack Obama. I think that is one of the awful things about that is that a lot of people are suffering because of an ideological position that some political leaders are taking here, and I wish I could do something to change that. But the fact of the matter is this is really bad for kids and families, really, who are waiting to have a means of getting on health care.
I've been covering politics for a long time.
Oh, that I know, yeah.
Few things that surprise me, but what is the argument that they make? What is their rationale for blocking these initiatives that would, in fact, help children and, in many cases, save the lives of children? What do they claim they're trying to accomplish?
So there's a couple of things that they would say right now. I'm going to try to put myself in the shoes of one of those folks, but don't make me stay there too long. But one of the things is that they say that this is the federal government interfering in what should be a local and state issue, which is Medicare and Medicaid. Secondly, they say it's going to add a financial burden to the state, even though the federal government, at least in the initial years, would pay for 100% of this. Medicaid is generally shared, the cost of it shared by the federal government and the state government. And even when the federal government stops paying for 100% of it, it only goes down to 90%. It just drops by 10%. That becomes the state's responsibility. So they're claiming a financial impact on the state, and they're claiming an ideological opposition to having the federal government in the business of doing anything around health care outside of the federal government's purview, which in their case is anything to do with the states. So we have both ideological and practical considerations. Both of them are utterly wrong. Many of those same governors who oppose it will be on Medicare shortly and Social Security, and I don't think they're going to be rejecting either of those. But there's also some latent, intractable level of, I don't know how, I don't want to overcharacterize this, but some feelings of hostility towards the poor, towards minorities, towards the poor. We're in a very strange place in the country right now, and it's hard to dissect it all out, but one of the problems is that the poor are not in the line of sight of many of the Republicans. Not true for all of them, but for many of them. There's no problem giving corporate tax breaks, but there seems to be something about helping the poor that's antithetical to their belief systems.
Well, this hostility to the poor, which has been manifest for a long time, has been the exact opposite of the way you've been throughout your adult life. When you were a young doctor, if I have this correct, you went down into the Deep South.
I did.
To provide medical care for poor children and families. Talk about that a little bit.
So right after medical school, I went to pediatric training, and I was headed down the road to become a pediatric heart doctor, a pediatric cardiologist. And I saw one day in the doctor's dining room, Denver Children's Hospital, a poster. It was from VISTA, Volunteers in Service to America. It was like the Domestic Peace Corps. And it said, if you're not part of the solution, you're part of the problem. And it described these horrendous conditions of poverty and racism and other issues in East Arkansas. And a phone number on the thing, and on the poster. And I called the phone number and went and visited the next weekend, canceled my pediatric cardiology fellowship after that. And in July of 1971, went to the sixth poorest county in the United States, Lee County, Arkansas, to run a health center down there. That was just an extraordinary experience for me, but 2 years of working in this very challenging but gratifying position to be in, to be helping people who really needed help. And that was, of course, left an indelible imprint on me going forward. And I've done a lot of things in pediatrics, but the thing that's been sustained is this real desire that I have to really try to create some equity in our society. I'm just very, it's not just about compassion, which I think I have, a level of, but I'm really continuously outraged by this inequity that we have in our society, the disparities based on income status, race, whatever. It's just, and especially see these children, Bob, and the thing that struck me over the years, and I'm writing about it now, is the amount of potential in children, from the poorest of the poor to much more affluent. But you can't distinguish from reading the dialogue of what a poor urban kid in the 7th grade wants to do when he or she grows up from what a more affluent kid wants to be, except that they get pushed down divergent roads, one to no opportunity and one to a lot of opportunity. I just don't, not only don't I think it's fair or just in our society, but I think it's ultimately going to really hurt America. We're going to need every single child to grow up a success story. And if they don't, they become a liability. And we're going to be facing a big problem with competitiveness for influence and economics and so forth in our world in the next 15 or 20 years. I think the least we could do is make sure our children grow up getting opportunity and fulfilling their potential, and that's really what's been driving me for a long time.
Well, I appreciate and thank you for your great work for many decades now, Irwin. I wish we had more time. We'll leave it there, but we'll talk again.
I look forward to it, Bob. Thanks for having me.
We'll be back in a moment with a final word. I keep hearing that the job market is improving, that growth continues to be modest but steady, and that there is reason to be optimistic. I'd love to be one of the optimists, but I'm not. The headline numbers mask the signs of enormous trouble ahead. Too many of the jobs being created are low-wage, part-time, and decidedly insecure. Over the past couple of months, the number of unemployed people has not declined significantly, and 1/3 of the unemployed have been without work for 6 months or more, some for as long as a year or 2 or even longer. These are not signs of a healthy economy. Equally disturbing is the long-term outlook. In a reversal of historic trends, advances in technology may well destroy far more jobs than they create. Robotics and artificial intelligence will continue to displace humans from a long list of occupations and professions over the next decade or two. These will include bus, train, and taxi drivers, accountants, customer service representatives, trash and garbage collectors, medical technicians, lawyers, teachers, and on and on. A survey by the Pew Organization quoted a technology researcher who said, "The central question of 2025 will be, what are people for in a world that does not need their labor?" Policymakers are not paying nearly enough attention to these developments. If they don't wise up soon, ordinary Americans will find themselves paying a very heavy price. That's all for now. See you next time.